Good evening everyone. I am Dr. Sarita, consultant in Obstetrics and Gynaecology at Aster Hospital. Today we are live with Dr. Soumya Lakshmi to discuss about the pregnancy care. So the topic of today is do's and don'ts in pregnancy. And this is she is a consultant in Obstetrics and Gynaecology. Over to Dr. Soumya Lakshmi for the further readings.
Hi everyone, good evening. I'll just go briefly about pregnancy and and then we'll take the common questions that are usually asked. If you have anything else to ask, please leave a question in the comment box, and if possible we will answer your questions. So pregnancy, as you all know, is a life is a milestone, an important milestone in every woman's life, and at some point or the other every woman wants to become a mother. But it is also I think one of the most sensitive and very emotional journey for a woman, and it is always fraught with a lot of worries, and no matter whether it's your first or your second pregnancy, you always have a lot of questions which you feel needs to be answered. So I will just give you a brief word on a brief introduction to, not even an introduction, I'll just take you through what we usually do in a normal pregnancy care. So one of the most what is the ideal age for me to get pregnant, because a lot of people are 30s and my parents are pressurizing me to getting having a baby. So what is the ideal age? So there is no real ideal age for a pregnancy, though of course we want a woman only after the age of 21 to kind of go ahead and plan a family, because before that our body is not very completely mature. I would like the first pregnancy to happen before the age of 35, because after the age of 35 there's always a risk of an increased risk of the baby having some kind of chromosomal anomalies, and the risk increases with increasing maternal age, right?
I think that will also tell us that as the age increases, the mother is also at risk of many medical comorbidities.
Yes, like diabetes,
like diabetes, hypertension, and
yes,
all those.
And also I think even practically speaking, when you 28-year-old mother, I think, is more able to give physically to her baby's needs than when you have a baby at 35.
True.
So even because pregnancy being a mother doesn't end with delivering a live baby. You have a lot of other things that you have to
we have to take care of the baby at the same time,
yes.
handling everything in the family.
Yes, exactly. So that is it. And when do we start treating a mother? Ideally, you should come in to us before you become pregnant. Look, in India what happens is most of the patients come to see a doctor when they miss their periods. They've done a pregnancy test at home and it tests positive. But if you go outside, a lot of people actually come for preconception counseling, and that is very important because we start off with what we call folic acid. It's a vitamin B which decreases the rate of abortions by almost 96%. We can also do a couple of blood tests like thyroids and sugars, just to make sure that you don't have any of those complications. And in case of any deficiencies, we can give you medicines, and we can make sure that you enter pregnancy in a much more healthy way. What else?
Being discussing about prenatal care, doctor, I would also want to ask you what all the tests or the care we give to the pregnant women, or they have to come and seek in that
before pregnancy, you're saying. So before pregnancy, see, the US FDA, which is the regimen that all of us mostly follow, they have advised that every woman who is planning a pregnancy should take about 400 micrograms of folic acid per day. The dosage of folic acid increases to about 600 micrograms during pregnancy and 500 micrograms during breastfeeding. But in India, I think because we also see a lot of women with anemia, a large percentage of which is contributed by folic acid deficiency, we usually start, all of us give folic acid 5 milligrams, isn't it? And it is ideally started 3 months before you plan a pregnancy. And it's a vitamin, it is water soluble, so it does not get stored in your bodies. You don't have any major side effects with folic acid. So I think it is quite safe to start, and it's the same tablet which is used in the first 3 months of pregnancy. The other things that we want to talk to you when you come for preconception counseling is what are the vaccinations that you have got? Have you ever had chicken pox as a child? Because then you become naturally immunized to chicken pox. But one of the most important vaccines that we want to give before you plan a pregnancy is rubella, which is also called German measles. Because if you contract rubella for the first time in pregnancy, 80% of the times the fetus is affected, and the problems could be varied from blindness to deafness to cardiac defects. And if the mother tests positive for rubella in pregnancy, we have no other option but to terminate the pregnancy, and which is completely preventable by one shot of a vaccine. So that is one thing. The other thing is hepatitis B, because hepatitis B is transmitted from mother to baby. So we also try and vaccinate the mother against hepatitis B. Now, the one good thing about hepatitis B is that the vaccination can also be given during pregnancy. Unfortunately, rubella and chickenpox vaccination and most of the other vaccines cannot be given during pregnancy.
I think one more important point is, now that PCOD is so rampant in young girls, we should also check about their blood sugars.
Yes, exactly.
And to advise them to decrease their weight.
Yes, if possible,
and all those things. Yeah. And the second question is, doctor, what are the activities or food that the pregnant lady should avoid as soon as she knows that she's pregnant?
Well, we'll take food first and then exercise?
Yes, okay. Anything first.
So the food, ideally I think all kinds of raw food is best avoided in pregnancy. First of all, raw meat, raw fish, raw mushrooms, they all contains, most of them contain either salmonella or listeria, which if the mother gets salmonella, she contracts typhoid, which could cause severe health problems in her, and God forbid if it crosses the placenta, listeria can ice creams at home, so you use raw eggs, hollandaise sauces after seeing MasterChef Australia if you're trying at home. So any kind of raw foods kind of really are a health hazard. So even street food in India, you really don't know what kind of water they're using, whether the water is ideally sterilized. So that's one thing I tell my patients, rule of thumb is, you can eat whatever you want, but just make sure they are cooked. It could be either steamed, boiled, fried, whatever, but if they are put into hot water or hot oil, most of the germs are killed. So that is one thing about food. Unpasteurized milk also should not be taken, because you have again a high risk of contracting listeria and toxoplasma, which is another dreaded virus which can cause severe brain damage in the baby. What else do we avoid? Caffeine, we say do not take too much of caffeine, because it is it's a psychotropic this thing, so don't take too much of caffeine.
What about this papaya, doctor? Because everybody commonly they ask the question is about papaya.
Well, I wish
papaya and sesame seeds.
Yeah. No, but I don't think there is anything in the literature which really, there is no scientific basis for avoiding papaya and pineapple. And a lot of cultures, I mean, especially the Western population, I've seen them eating a lot of papaya and pineapple.
Good, in fact, it's rich in vitamin A, C, and all.
And I don't think there's any, scientific, there's no evidence to support that
even
eating
people
those.
say that they should not eat too much of heat food like chicken or this mangoes.
But in allopathy, we don't have anything.
We don't
heat and cold, right? Our body, our body maintains its temperature no matter what you eat. So I don't think all that is. Then coming to the next point, what is activity? Yes, activity. Well, again, there is no restrictions of activity. You can do whatever you are comfortable with. We've had patients who are marathon runners, and a lot of young women nowadays, are into extreme sports. And so somebody who runs a 21 or a 42 kilometer marathon, I'm sure can run 2 or 3 kilometers daily, even in pregnancy. However, if you're not used to that kind of exercise, I don't think pregnancy is the right time to start. Of a exercise regimen. All kinds of exercises allowed. In fact, we encourage people to do exercises, especially yoga, Pilates, low intensity aerobics, and all can be done. Of course, any exercise which, or maybe like, off terrain, biking or cycling, they always are associated with some risks of injuries. You fall down.
True.
So those kind of injuries could cause injury even to the pregnant uterus. So tell them to avoid those kind of things. But otherwise,
you mean
swimming,
to only say that strenuous activities.
very strenuous. But I think swimming, aerobics, yoga, Pilates, I think it is encouraged. Don't you encourage them to do it?
Yes, we are there. In fact, the pregnant ladies have to be more active so that they don't gain that excess weight and land into complications. And one more question, what regularly we come across is, because many of our pregnant women are working women, they just ask us one question: can I travel? Can I travel from one place to other place? Can we travel from one town to other town?
Yes, see, from one place to another, I don't think anybody now in any major city in the world can really avoid travel. All of us have traveled in pregnancy, and traveling as per se does not cause any problems in pregnancy.
What do you feel the best mode of traveling is during pregnancy? If you have to choose among the
I would choose walking. If you could walk, that is exercise plus.
That is quite difficult.
But otherwise, I think I don't think there is anything to choose from one mode of transport to another, isn't it?
Or a flight journey.
Well, flights are a totally different thing, because most of flights allow travel only up till 32 weeks.
Yes.
Because after 32 weeks, especially domestic flights, they have very little space between the seats.
True.
And most of the airlines don't even want to take the risk of somebody getting into a preterm labor or any kind of problems in flight. So they usually ask us. But train travel, bus travel, I think should be okay till about 36 weeks. And we've had patients whose parents live in, say, Channapatna or Mandya, which is a 1 hour, and they've gone home 10 days before their dates, safely reached home and delivered. So there is really no I don't think we can really put a time frame to travel and mode of travel. As long as they're comfortable, I think everything should be fine.
Yeah. Doctor, one more question we have coming up. What are the additional nutritional needs of a pregnant woman?
Well, additional nutritional needs. Definitely, a pregnant woman needs additional nutritional needs. Okay. So the initial studies said that a pregnant woman would need about 1,500 calories extra per day, and in breastfeeding also we would say 1,500 to 2,000 calories. But now I think even that has been there has been a lot of talk about that, because somebody who is a slender young woman would be okay to have an increase of 10 to 12 kg body weight in her, all through her pregnancy. But if somebody is already entering pregnancy in an overweight condition, we would really not want her to put on even more weight, because everything then becomes difficult. Delivery, if it's a cesarean section, that becomes difficult. Higher chances of diabetes, BP, so many things. So again, we don't have any diet thing, but the only thing is we want them to have a balanced diet and increase the amount of proteins that they take, because proteins are necessary for tissue and muscle development, and so protein intake should be higher. And I think you get that a lot when you take your pulses and your eggs, sprouts, and your dairy, and your meats and stuff like that.
And also there's lots of fruits and vegetables we need to include in the diet, which we would not be doing earlier. And how much of water intake and milk intake you would recommend in pregnancy?
So again, so there is no fixed amount of water or milk that you take. Water, of course, everybody is allowed. Asked to. We should all be taking at least 1.5 to 2 liters of water a day.
Or non-pregnant state.
So it doesn't really change just because you're pregnant. You don't have to take any extra water, but you have to be adequately hydrated, because you know that a lot of in pregnancy there's normally a fall in BP and people end up getting giddy. So I would suggest taking a lot of water. It also ensures that you pass a lot of urine, and which is one of the best ways to prevent urinary tract infections. Milk, I'm not so sure, because a lot of people get put off by the smell of milk sometimes. So milk basically for us is it contains a lot of calcium, but we are already supplementing most of our patients with calcium. So I'm not very particular about them taking, so much amount of milk. If they are happy taking it, I'm okay.
I'm tolerating.
If they're tolerating, but
and
I don't think we need to force women to take milk if they're not really comfortable.
So what is your recommendation regarding the protein supplements, like in the form of a powder? What regularly they keep taking and asking for us?
No, again, I don't think there is any evidence based for protein supplements. Yes, if the baby is showing signs of decreased growth potential in the uterus,
or the mother is of low weight,
yes, then maybe we could add proteins. But then I would actually then recommend them to see a dietitian. Make sure the dietitian knows what they're really taking, what their normal dietary intake is, and then let her make a very scientific chart about what
so that
supplements she
becomes
needs.
more important, because any extra additional foods which they are not able to afford, that matters a lot. We have one question from a live patient, that what are the superfoods to consume during pregnancy?
Oh, so the superfoods, omega-3 fatty acid is one superfood that is recommended. You get it a lot in cold water fish like salmon and tuna. Yes. But again, make sure that it is cooked properly. Don't have tuna sushi, because you could end up getting some other infection. Vegetarians, seaweed is a very very, very strong. It has very strong concentrations of omega-3 fatty acids. You also get omega-3 fatty acid capsules now over the counter. But other than that, superfoods.
I think there's iron-rich foods like lean meat, eggs.
Yeah.
Many of them have a problem, and they don't know the importance of having the whole egg for that matter, because many of us consume only the white. Whereas there are also a lot of important things, and also these iron-rich foods. Once they become pregnant, I think they will have a lot of these dry fruits. So what is your comment on it?
Well, if there's nothing wrong, they want to have dry food, let them have it.
Yeah.
Yes.
Okay. And the next question is, will exercise help to prevent the weight gain during pregnancy and post-delivery?
Again, we'll take it as during pregnancy and
yes.
So exercise, no matter what you do, you are going to get weight in pregnancy, because the weight gain in pregnancy is not only the amount of fat or muscle mass that is added in your body. The weight gain in pregnancy is also it's influenced by the weight of the baby, the growing placenta, the water around the baby. There's a lot of water retention in our body. So no matter what exercise or diet you take, you are going to increase weight in pregnancy. And basically pregnancy is not the time to diet and concentrate on weight loss.
Because there are a lot of cravings during pregnancy. What happens?
So try and at least cut on your junk food, because you don't want to end up with a lot of weight in pregnancy. People, I think, who are who are on the leaner side, still have the comfort of eating whatever they want. But exercise in pregnancy is important, not to lose weight, but it's important because it is proven to increase the chances of normal labor and delivery. It has been proven to have very good effect on the cognitive mood variations of the mother as well as the baby. It is very well known to control diabetes if you have abnormal sugars, and also your BP and other stuff are also kept in control. So exercise, I think, is always recommended.
I think we have many of the doctors who have been trained in antenatal exercises, and also the Lamaze classes, which we also have practiced in our Aster CMI hospital, which would help them to take the pregnancy all through easily. And if they're not in a position to go to the exercise classes, what would be the basic recommendation of walking you would recommend them to have at home?
So that again, I usually ask them to walk at least 30 minutes of walk. But like I said, if somebody is not used to walking at all, I think let them start with 10 minutes and then slowly increase. Somebody who's already somebody who's been really rigorous in their exercise regimen can continue. But I always tell them, please listen to your body, and because your body gives you enough signals, and so listen to your body and stop when you feel uncomfortable. But other than that, there is really no recommendation.
You recommend that 30 minutes of walk would be good enough for the health of her. And what about the post-delivery weight loss?
Well, exercise definitely helps in post-delivery, weight loss, toning of muscles especially, because a lot of people come back with backache following delivery, and you really need to do a lot of back strengthening exercise too, because you've already lost a lot of your anterior abdominal wall tone. So toning, exercise will help with toning. It gives you, releases endorphins. You feel good.
And also that because they are breastfeeding, the posture of breastfeeding.
Yes, posture of breastfeeding.
And restlessness.
Yes, all that.
Yes, all that may be.
And what else? I wanted to tell something else. I forgot.
Okay. So and then coming to one more question, what we have got through is wearing seat belt at term gestation safe enough?
Yes, you must wear a seat belt. But the important thing to remember is seat belts have to be worn correctly. Yeah. So in a pregnant woman, even at term, because now all of us, we are always on the go, so you should be, if you're independent, you want to be independent, there is absolutely no need to restrict yourself. So you can drive your car, but it's an absolute necessity to wear your seat belt. So the important thing about seat belt is to make sure that it's the seat belt should have a shoulder and a lap strap. And the way you wear it is, the shoulder strap should come over your shoulder, not your neck. It should come between the breasts, rest on the breastplate. Now the lap, the belt is the most important. The lap belt should come below the baby bump. Okay. And the belt should sit on your thighs, and the lock should be just near your hip joints. The problem arises when the lap belt is over your abdomen, because when that happens, God forbid there's an accident, the strap can cause more damage. Okay. So it's like having a direct impact on your abdomen. So the bump should be between your shoulder strap and your lap strap, because what happens when you wear a lap strap below the baby bump is that the collision, the effect of collision, the whole impact is transmitted more to your hip joints, which are the most strongest joints in the body. Oh. So that is the most important thing. So if you're driving late in your pregnancy, please make sure that you always wear a seat belt, and make sure that the seat belt is worn properly.
Okay. So commonly what all the pregnant ladies have the doubts is, can we take medicines during pregnancy? Like if they get a headache, they get a cold or a fever, or what tablets are recommended is what they always have a doubt.
Look, I think paracetamol, antihistamines like cetirizine, they are safe. But antibiotics or any other, antibiotics, anti-epileptics, diabetic medicines, they all have to be taken only under the supervision of a doctor. And so those have to be taken only if they're needed. The dose, the duration, everything has to be explained properly, and they have to be taken only under a doctor's advice. I mean, yes, you can't just self-medicate, especially BP medicines. You've seen people, they have high BP, they go back, they check at home and they realize the BP is less, then they stop. So please do not self-medicate or just stop or start the medicines at your way.
No, I think whoever is being detected to be diabetic even before pregnancy and hypertensive, or with any of the kidney problems or any liver problems, they have to consult a doctor as soon as they miss periods or detect pregnancy, because there has to be a conversion to a safer medicine during pregnancy. That's
yes,
it, right?
Yes.
Yeah. And one more question is, though many of us are aware that how important are the ultrasound scans during the whole of the pregnancy, we still have some pregnant women coming and asking, is scanning in first month or a second month important? Or what are the recommended scan durations?
Okay, so we first do, usually the two most important scans are between the 11 and 14 weeks, and one between 18 and 22 weeks. Yeah, those are the two most important scans. But we also do a scan at 8 weeks because that tells us whether, or sometimes if the patient comes with bleeding or abdominal pain, it is done earlier. But that is to find out whether the pregnancy is intrauterine, because there are that 1% of pregnancies are sometimes located located outside the uterus, and they have to be detected early so that we can manage them medically, because otherwise so many people come with a ectopic pregnancy which has ruptured and they have already bled into the abdominal cavity, and then they will need emergency surgery. So what we usually do is we do a scan early between 7 and 8 weeks, so that we can confirm an intrauterine pregnancy and also detect the heartbeat, so that we know that it's a live and healthy pregnancy. Then we do a scan at the 3rd month, then at a 5th month, just to make sure that the baby is healthy. 32-week scan, a growth scan may not be very necessary, but if the doctor feels that the baby is either too big or not of a size expected at that gestation, they might ask for a growth scan.
And also if they have developed any recent medical complications.
And then of course we have one scan that most of us do just before delivery, which helps us plan the mode of delivery and what to be aware of and what kind of things we should be ready for during the process of labor.
Okay, and what about the vaccination during pregnancy, doctor? What are the recommended vaccinations to be taken up?
So, like we've already said, pre-pregnancy we've already given rubella, chickenpox, and a hepatitis B vaccine. In pregnancy, tetanus is the only vaccine that we give. And recently, we have started giving what we call triple vaccine, which contains tetanus, diphtheria, and Asulella pertussis. So the woman needs to take only one shot after 29 weeks of pregnancy, and that also prevents diphtheria and pertussis in the newborn, because the newborns can take their first shot of DPT only at around 6 to 8 weeks. So for the 6 to 8 weeks, because the mother has already taken this vaccine, the babies are passively immunized because of the vaccine. The other vaccine that we usually now give is also influenza, because we see a lot of influenza cases, and it is very difficult when a neonate gets it. And so I think the H1N1 vaccine is given to a newborn only after the first 6 months. So again, if the mother takes it during pregnancy, the baby has a benefit for the first 6 months. So we also give influenza vaccine.
Okay. Now, having been discussed about the pregnancy and all the important aspects, coming to the delivery. Nowadays, many of them come and ask us about how about normal delivery, how about C-section. Many of them directly go opting for C-section. So, can you put some light on it?
Yes. I think if we ideally wait till dates, and maybe even a 3-4 dates post date, almost 96% of patients go into labor spontaneously. And once you go into labor spontaneously, almost 90% of the time a normal delivery is assured. It's only when we induce before dates, which could be because of so many reasons. Maybe the patient has diabetes or BP or some other, or the baby is not growing enough. But whenever we induce labor, the chances of having a C-section rates go up a bit, But if you actually wait patiently and allow the patient to go into labor spontaneously, most of them end up with a normal delivery. A lot of people are scared about the pain of normal delivery, but now we have so many analgesic methods. You have epidural, which makes the whole process of labor so painless, and
Entonox,
inhalational analgesia. So there are so many things now that we can do to make your labor experience painless. And once we take care of the pain, I think most patients are quite confident of going through the process of normal delivery.
And also because of the pain, they are quite stressed out both physically and mentally, and they're quite relaxed in that phase of thing. But one thing I would add upon is not that every induction goes in for section, as most of the people think. They always have the fear when the doctor says induction, they think okay, they're planning for C-section. It's not that way always. Doctor, one more question we have, and it is whether the instrumental delivery is safe, either it be a vacuum delivery or a forceps delivery.
Yeah, they are very safe, because instruments have been used for the last 100 years.
Yes.
And there are this huge pile of evidence saying that instrument delivery is safe. We have certain prerequisites that we make sure are ticked off before we even put an instrument. So instrument deliveries are safe. In fact, nowadays we put instruments only when we see the head, right? So it's almost there. It's just that that over the whole period of labor, the mother is so exhausted that they are unable to push, or at the last minute the baby's heartbeat drops and we need to extract the baby immediately, and that is the only reason. So what
can avoid
you can just emergency sections.
Yes.
So instrument deliveries are absolutely safe, and in a safe pair of hands there is absolutely no need to worry.
Yes. One more thing is, once a pregnancy is crossed the period of viability, which we usually take after 22 weeks in out countries, and in our country it's 28 weeks of pregnancy, how should a pregnant woman keep a watch on the baby? And how can she have the alarming symptoms to come to a doctor?
Yeah, so one of the most important things that we say is the daily fetal movement count. So the rule is that there are two ways of looking at the baby's count. Either it is you chart your baby's movement over a whole 12-hour, your waking up time, and they say if you have 10 movements in your whole day, it's a fair sign that the baby is doing well. Now most of us, like, we're working and we don't have, we can't keep a close count on the whole day. So what we say is, after every major meal, that is after your breakfast, lunch and dinner, just keep a count for the next 1 hour. At least 3 movements in 1 hour is an adequate. So that actually comes up to 9 counts in the whole day.
Yeah.
So that itself is a good measure of good baby health. Yeah. And the other things to look after is any intermittent painful contractions of the uterus, any vaginal bleeding, any abnormal foul smelling discharge, or even watery discharge from the vagina. It is always better to come and meet your doctor and just make sure that everything is okay.
Yes, even if it is coming and going negative, if we have to assure that everything is going fine by checking out the baby's movements, by checking out the baby's heartbeat tracing, and make sure that everything is fine. Anytime if the count is less, I think the pregnant woman has to come down to the doctor. Doctor, one more thing is, whenever a pregnant lady has some pain or a bleeding, they sometimes take it as a normal issues, because the elders in the house, they may say, okay, this is the starting of your pain, still there is a lot time to wait, we can wait, and all those things.
So that is exactly what I say. Painless bleeding is one of the most is one of the first signs that your placenta might be low lying, and a small initial bleed which you kind of not take seriously could end up in a torrential bleed and major problems. Pain associated with bleeding could be a first sign of placental abruption, that is separation, a premature separation of a normally situated placenta, which means that the oxygen supply to the blood to the baby is suddenly cut off because the placenta that is inside the uterus has separated. So without you having signs of labor, you could just have small abdominal pain or just little bit of spotting, and a lot of people just ignore the fact, and then they come in very late when they are dizzy, or when they have really lost a lot of blood inside the uterus, and their BP is falling, and many a times we have lost babies.
Yes, because the placenta is a main connection for the supply of oxygen and nutrients to the baby. Once that gets detached, there is a fraction of a minute or a second that the baby may go in for intrauterine fetal demise.
So I think the rule of the thumb is anything abnormal, please come to the hospital, please see your doctor. They are the best person to judge, to find out whether this is normal or not. Just let them have a look, and everything is fine, you can go back home. I don't think you should, nobody should be taking a risk.
Yeah. And one more question is, what are the important blood tests to be done and when?
Okay, so I think at the first visit we do a blood grouping of both the parents to see if there's any incompatibility between the blood groups of the parents. We also do a sugar, because as a population, Indian population, we are prone to diabetes. So we do a sugars. Thyroid now is thyroid the abnormalities are rampant. So we also do a thyroid test, because it can be easily set right. So these are the
and thyroid is also quite important, because hypothyroidism and lack of thyroid hormone supplementation to the baby is very important, because the first 3 months is a important period for the baby's brain development.
Yes. So hypothyroidism is one of the most common causes of mental retardation in children. So these are the tests, and then of course we do all the serology, because HIV, HBsAg, because they have a potential of being transmitted from mother to the baby, and now we have medicines with which we can completely prevent 100% prevent transmission. Yes, mother to child transmission. So serology is another thing that we do between 28 glucose challenge test, which is a screening test which tells us whether the mother is at a risk of developing diabetes later on in pregnancy. So I think these are we don't have any not very expensive tests, very basic tests.
Yes, at least that if we find that there is a less of a hemoglobin, we could rule out the cause and treat them with some iron tablets and injections. One more common question is sexual contact permissible during pregnancy?
Well, I think as long as the woman is comfortable, sexual contact is permissible. Of course, as the uterus grows in size, it becomes more difficult. But then each one to his own. So as long as
because they have the fear that the first 3 months of pregnancy is quite sensitive.
No, but of course, if we see that the placenta is low, or if the patient has come with episodes of bleeding, then we would tell them to abstain from intercourse. But if not, I think we have no restrictions.
Having the sexual contact and all through the trimesters.
All through the trimesters.
Okay. What are all the things a woman should remember in context to going through the pregnancy? Because there are a lot of financial issues, family issues, everything, the burden on the woman. So how do you think that they should cope up with themselves?
Well, that is what having a healthy diet, exercising as much as you can, making sure that you get some rest. And then really discussing, but pregnancy is another time where the partner should really be completely invested in the woman, because there are I think this is one of the most susceptible points in a woman's life. You feel very vulnerable because you're scared. Labor pains are not easy. They're very painful, and at that time all you really need is a lot of support from your partner as well as the family. You've seen a lot of
TLC, that is tender love and care.
Yes. And you know what, as a family, I think we should also be very open to what she needs, because we have seen so many people who've gone through a long labor, and we tell them, I think cesarean is a good option, but then there'll be so much of family pressure saying that no, can we wait for another 2 hours, and when the patient is telling us I can't hold on a minute longer, and that waiting is also not really going to change the outcome.
And also they have a lot of the psychological issues, and they're also going for a lot of depressions.
Yes, postpartum depression is also very
even during pregnancy we have seen them going through the psychological counseling.
So a lot of support, emotional support from friends, family, and especially the partner will really go a long way in ensuring that her pregnancy is a wonderful experience for her.
Well, one thing what I would say is, if you can change, otherwise leave it.
Yes.
That is the thing, because you and your baby are the most important things all through the 9 months of your pregnancy.
Yes, easier said than done, but yes.
Yes, that is true, and especially in India it's very difficult. I know, I do understand, but women should be strong enough to take care of themselves and their baby, though everyone may not support you.
Thank you.
Okay. From this, we end today's session. We wrap up and hope we have answered all the important questions, what it was. And if not anything, please drop in your comments and questions in our Aster website, and we would be always welcome and pleasure to answer all your questions. Thank you.